let's first start talking about a couple of different blood pressure medicines that we consider first-line therapy in most diabetes patients. There's only going to be one aside to what I'm speaking of, and that may be in African American patients. African American patients are slightly different because their blood pressure tends to be slightly different in origin sometimes. So if you're an African American, these medicines certainly continue to be first-line therapy, but the order of medicines is not as important as that you're probably on a blood pressure medicine. So what are the first-line therapy drugs for high blood pressure? Most people would say that that's an angiotensin-converting enzyme inhibitor or an angiotensin receptor blocker. Wow, that's a lot, isn't it? So what we do is we actually condense that down. The first one we call an ACE inhibitor, and the second class we call an ARB. And everyone gets confused because there's so many different drugs on the market. How can you tell which of these you're on? Well, if you're on an ACE inhibitor, it's going to end in PRIL, PRIL. So if it ends in PRIL, you know that it's an ACE inhibitor. If you have an ARB, or an angiotensin receptor blocker, I can tell you it ends in sartan, S-A-R-T-A-N. So you don't have to know the whole name, you don't have to know everything about it, you just have to know the end. And most blood pressure drugs are like this. So ACE inhibitors and angiotensin receptor blockers are considered first-line therapy in diabetes. Why? Well, they protect the heart, and they've shown to have special kidney protection. It doesn't matter if you have type 1 diabetes or type 2 diabetes. The special kidney protection means most people with diabetes are going to be started on one of these two medications. Why would one be used over the other? Well, many times the ACE inhibitors have many generics within them, but the ARBs only have at least one generic. So most people today are going to be started on an ACE inhibitor, and then if they can't tolerate that, they might be switched to an ARB. What kind of intolerances may you have to an ACE inhibitor? The most common side effect that you could have is kind of a dry, hacky cough. And maybe 10 to 15% of people will actually have this dry, hacky cough. If you have this dry, hacky cough, it's actually indicated to switch to the ARB, or the angiotensin receptor blocker. But both of these work by blocking the effects of one of the most potent constrictors of blood vessels that we have known to date, called angiotensin II. So both of them working on this very potent constrictor by blocking its actions or its formation actually work to protect your kidneys and the rest of your body from high blood pressure. So we're on to calcium channel blockers, I guess. Calcium channel blockers are made up really of two distinct parts within calcium channel blockers. Well, what do calcium channel blockers do for you? We started off, yeah, kind of. So calcium channel blockers, what do these do for you? They're really made up of two different classes of blood pressure medicines within calcium channel blockers. If it ends in P-I-N-E, or peen, you're going to find that these kind of calcium channel blockers actually help to vasodilate or actually relax the blood vessels in your body. By doing that, it's actually going to lower the blood pressure. These drugs, just like the other ones I've mentioned before, are protective to your heart, and by lowering blood pressure are going to help protect you from the other complications of diabetes. What is the other side of this class then? There are two different medications you may be on that are different than any of the ones that end in PINE. And these are called verapamil or diltiazem. And so there's no quick way to remember those. They're just different. And these actually work slightly different and actually work in the heart as well to slow down the heart rate. So some people, healthcare professionals, may choose these over the other ones that end in the PINE because they help to slow down the heart rate. But overall, the side effects are fairly similar. The PINE ones actually have mostly swelling in the legs. We call this, in medical terms, peripheral edema. And somewhere around 10%, 5 to 10% may have that. Or dizzy woozies, as you would call it. So when you stand up, you get dizzy woozy. How would you actually overcome this dizzy wooziness? Well, what we tell people is when they get up in the morning or the middle of the night to dangle their legs on the side of the bed for a little bit, And then what to do is to stand up slowly with the support of something. Usually that's enough to get over the dizzy woozies. If it's more severe than that, talk to your healthcare professional about other things that you may need to do. See, we're on to diuretics. Diuretics. Really, diuretics are made up of two different classes of diuretics. One class of diuretics we commonly use for high blood pressure all the time, and these are called thiazide diuretics. Now, why they're called that just has to do a lot of times with things that has nothing to do with something that's important to you. But what is important to you is that thiazide diuretics are a staple medication for the treatment of high blood pressure. So diuretics, at least at first, seem to help your body get rid of salt. And that's why they're a diuretic. And where salt goes, so goes water. So that's why they call it a diuretic. Long term, though, these actually don't increase urination. So why do they lower blood pressure? Well, they seem to kind of change some of the system, the blood vessels, and by doing that, they are going to continue to lower blood pressure even though they're not causing you to continue to urinate. What are the problems with these drugs? Well, they can affect some of the electrolytes in your body. So it's important that you're working with your healthcare professional to make sure that your electrolytes, what kind of electrolytes? Specifically, sodium and especially potassium can be affected by these drugs. Some of them can, most of them for thiazide diuretics will make the potassium go down. The other thing that may happen is occasionally is a rash. If we talk about the other side of diuretics, these diuretics are mostly very high-powered diuretics. These diuretics are used to try to take a lot of fluid off of people. So we call these commonly, quote-unquote, loop diuretics. And they actually end in mide, so furosemide, torsemide, they end in M-I-D-E. And by being more powerful, these are going to have to be taken usually multiple times a day if you want to use them for blood pressure control. But most people are using them simply to get water off of people who may have extra water on their body. That's in comparison to the thiazide diuretics I mentioned, which are all once-a-day medications to treat high blood pressure.